I'm actually so glad you hit on that because we know that oftentimes getting men to see the doctor is really not the man himself, it's their spouse that's actually driving the bus. And we don't do a good job as urologists in general of understanding that, and we as physicians in general are not really cognizant of the role of the spouse and taking care of. When we look at survivorship, if you'll look at everything that we do through the foundation as far as survivorship, everything we do is aimed at the family, is aimed at the spouse, the significant others, the children. And it's even more interesting, and the reason that this is exceptionally important is what we call epigenetic effects. And that's a new expression that's been actually applied, saying that something that your father did and even your grandfather did could have genetic impact in your life. It's passed on epigenetically. It's not even in the chromosomal material directly, but it's attached to the chromosomal material. And so it can't be measured, it can't be found. And so we're now finding things that are happening in children and grandchildren that really weren't measurable impacts. Those are the epigenetic effects or field effects. And so now we understand that this is really important. So the role of understanding survivorship is not just survivor of the individual, it's survivor of the family. And so our foundation's goal is survivorship for the family. And so that's why it's really nice to see spouses here today, because we understand the importance and the role that you have in supporting each other. We would wait anywhere up to a year before we'd intervene in improving one's sexuality. We would not do anything. We would say it takes up to a year, we're just going to wait the year. We literally would have men wait for a year before we would do anything or address sexuality. And now it's different. How is it so different?
Now we're very aggressive. We have at Michigan Institute of Urology, we have a whole program, Penile Rehabilitation program, where we have dedicated nurse practitioners and nurses that will work with our patients, and they start a few weeks after surgery or a few weeks even after radiation treatments. We'll aggressively treat these patients. And it's the same concept as knee surgery. If you were to have knee surgery, have a scope, or have a knee replacement, you know, you're going to be in physical therapy a week or two later. The same principles apply to penile rehabilitation, where we want to get the nerves and the blood flow back into the area of injury and start treating this. So within a matter of weeks, we have these guys in our penile rehabilitation program working with our nursing staff and getting things going again. You know, and we see great results. And it also, kind of what John alluded to, kind of draws these guys in to be in touch with their bodies, you know, because there is, you know, I always say this day in and day out, guys are terrible patients, but if we can, you know, get them more in tune with themselves and draw in that partner as well, it leads to, better patient satisfaction.